Assalamualaikum doctors. In this video I am discussing how can we take the history of systemic lupus erythromatosus, SLE history. So first we know the SLE features are they have mouth ulcer and nose ulcers. They have skin, we find butterfly rash and red patches. So butterfly rash, look the face of the girl. Heart we find endocarditis, atherosclerosis, inflammation of the fibrous sac, severe abdominal pain, blood anemia, high blood pressure, muscle and joint, there is pain and arthritis, swollen joints. In lungs, we find pruritus, pneumonitis, pulmonary emboli, pulmonary hemorrhage, kidney, blood in the urine, hair loss, high fever, abnormal headache. So lots of features like arthritis we ask about, hematuria, abdominal pain, joint pain, hair loss, alopecia, rash present. These are the features. Now chief complaints it can present with child with knee pain for 4 months. Child with headache can be calm and child with back pain. So after analyzing we will go, then we can find the history. So first, if the child present with limping, suppose limping, so we ask about unilateral or bilateral, onset, course and duration, what make it better and what make it worse. Painful joint, analysis of the pain, Socrates, like site of the pain, onset, character, radiation, associated symptoms, timing, course, exacerbating or relieving factors, severity scale from 1 to 10. Other joints like previous similar attack, look, feel, move, relevant. So is there how it looks like, reddish, how it feel, temperature high or not, movement limited or not, we are asking. So these are we asking. Then what did you do for that? Medicine, test and imaging. So it is a long time we ask that what did you do for that? Medicine, test and imaging. General FWASL, we know that about fever, unplanned weight loss, change in appetite, decreased activity, easy fatigue, sleep disturbance, pain at night, morning stiffness. Other concerns, long term any medical condition or chronic illness, if yes, all past history now. So long term any medical condition or chronic illness present or not, we ask. Then go the systemic review. From MSK, if we start, is there any skin rash? They will tell that malar rash in the face. That is actually the diagnostic point we understand. Skin spots, pigmentation, skin lumps, joint pain, joint swelling, bone pain, hair, nail changes. So hair and nail changes also we add there because alopecia present. Then urinary change in the pee, amount, color, frothy, frequency, pain, swelling in the private area. Anyone measure the blood pressure. So urinary, there is urine color also change, blood in the urine, hematuria can be present, frothy it can be, and blood pressure, anyone measures or not. Now GIT about the tummy pain, tummy distension, recent change in poo and mouth ulcers. Remember mouth ulcers present there. Now CNS plus neuropsychiatric like headache, morning vomiting, facial asymmetry, curving of the back, unusual walk, unusual movement, mood change, unusual behavior, eye redness, eye deviations, any concern about vision, hearing and speech. Hematology about the bleeding, bruising, recurrent bug, all details, especially the sickle cell disease or hemophilia. So any bleeding, bruising, recurrent bug, chest, difficulty in breathing, recurrent bugs and chest pain. Endocrine, diabetes mellitus, blood glucose, thyroid, hot or cold intolerance, additions plus other autoimmune disease. So autoimmune disease associated with that. So we exclude the diabetes, blood sugars, polyuria, polydipsia, then thyroid, hot or cold intolerance and Addison's disease, feeling weak, fatigue, these are. Past history, follow trauma, traveling like camping, Lyme disease, we can ask. Okay, CVS I missed. CVS is awareness of the heartbeat, heart racing, intolerance to exercise, easy fatigability and blood pressures. Then past history, we know the 5TIOA. So follow trauma, traveling history, camping, Lyme disease, medicine, steroid, drug-induced lupus, test done, imaging done, recent viral infection, acute myositis, transient synovitis, admissions and team they are following. So any medication taken or not, because drug-induced lupus can be present. Parental history, any medical conditions of medicines taken during pregnancy, screening for DDH, developmental dysplasia of hip, any bone deformity that needed treatment. So screening for DDH, as they have limping, they tell problem. Puberty, we are asking if around its age, did Alia started her monthly period, did Ali show features to be a young man? So Alia started her monthly menstruation, or did Ali show his features of man look like? Or ask directly, started puberty. Vaccination up to date, any extra vaccinations, allergy to food, medicines, nutrition, if any change in weight, growth, chart especially if known case on steroid treatment, development, loss of any skills, difficulty in walking, writing or wearing clothes. Family, same condition, family history of any long-term medical conditions, psoriasis, consanguinity, family history of family dynamics. Social home modification done or not, school-like type, absence, performance and bullying, psychological impact, how does this condition affect the family? Now differential diagnosis we can keep on top, positive data from the history. So this is a case of joint pain and rash. For DD, systemic lupus erythematosus on top, Dermatomyositis we can keep systemic onset of GIA and psoriatic arthritis. Again, SLE, dermatomyositis, systemic onset of GIA and psoriatic arthritis. This is all about how can we take the SLE history management portion. I will give another video. Thank you.